Tools and resources. Is your diabetes under control? How to count carbs with diabetes. A diabetes menu plan. Tips. Stay healthy with diabetes. Preventing diabetes complications. Everyday tips for diabetes. Diabetes, the most common disorder of endocrine, the hormone system, occur when blood sugar level in the body consistently stay above normal. It affects more than 23 million people in the U.S. alone. Diabetes is a disease brought on by either the body's inability to make insulin, type 1 diabetes, or by the body not responding to the effects of insulin. Type 2 diabetes. It can also appear during pregnancy. Insulin is one of the main hormones that regulates blood sugar level that allows the body to use sugar called glucose for energy. Talk to your doctor about different types of diabetes and your risk for this disease. In the U.S., 57 million people over the age of 20 have blood sugar levels that are higher than normal, but not too high enough to be classified as diabetes. This is known as pre-diabetes or impaired glucose tolerance. While people with pre-diabetes usually have no symptoms, it is mostly always present before a person develops type 2 diabetes. However, complications normally associated with diabetes, such as heart disease, can begin to develop even when a person has pre-diabetes. Once type 2 diabetes develops, symptoms include unusual thirst, a frequent need to urinate, blurred vision, or extreme fatigue. Talk to your doctor to see if you need to be tested for pre-diabetes. By identifying the signs of pre-diabetes before diabetes occurs, you can prevent type 2 diabetes altogether and lower your risk of complications associated with this condition, as heart disease. Type 1 diabetes occurs because the insulin-producing cells of the pancreas, called beta cells, are destroyed by the immune system. People with type 1 diabetes produce no insulin and must use insulin injection to control their blood sugar. Type 1 diabetes mostly commonly starts in people under the age of 20, but may occur at an early age. Diabetes is a lifelong chronic disease in which there are high levels of sugar in the blood. What are the causes and symptoms and treatments of diabetes? Possible causes of diabetes: too little insulin, resistance to insulin, family history of diabetes. The common symptoms of diabetes: excessive thirst and appetite, increased urination, sometimes as often as an hour, unusual weight loss or gain, fatigue, nauseous, perhaps vomiting, blurred vision, in women frequently vaginal infection, in men and women yeast infection, dry mouth, slow healing sores or cuts, itching skin, especially in the groin and vaginal area. Various methods of treating diabetes: insulin, exercise, diabetes diet. In conclusion, diabetes is a very common and affects 30% of the world's population. Diabetes is a slow killer with no known curable treatments. However, its complications can be reduced through proper awareness and timely treatment. 3 major complications are related to blindness, kidney damage, heart attack. It is important to keep the blood glucose level of patient under strict control of avoiding the complication. One of the difficult tight control of glucose level in the blood is such attempt may lead to hypoglycemia that creates much severe complication than increased level of blood glucose. So, in order to keep a low level of diabetes, you eat right, you do the proper exercise, and drink plenty of water. I'm Markus Thomas. Thank you.